Hey guys, welcome back. Today we're going to be discussing 5 myths about PCOS. I'm Dr. Dustin. I'm a board-certified dermatologist. I treat and diagnose PCOS in my clinic, as well as many other conditions, and my goal through social media is to help you become more healthy and beautiful inside and out. If you find this video helpful, share it with somebody who could benefit. Polycystic Ovarian Syndrome, or PCOS, is a relatively common condition, and today we're going to cover the 5 most common myths that I hear when it comes to PCOS. If you want to know more about the condition, I have a whole YouTube video all about the skin findings, laboratory findings, and other things you need to be aware of with PCOS. You can definitely check that out on my channel. Myth number 1, you did something to cause PCOS. This is simply not true. PCOS is a multifactorial disease. It's heterogeneous. That means that there's many potential causes, but there's nothing you can necessarily do or not do to cause PCOS or to prevent it from happening if you have the right mix of genes. We do see PCOS a little bit more frequently in families with a history of PCOS, so we know that there is a genetic component. As with many conditions, it's tempting to blame ourselves, and sometimes there's individuals on the internet who will blame you and say, if you do this, you'll reverse your PCOS, but that's just not the case. There are treatments to help manage the symptoms, but you're not going to just turn off your genetics. Myth number 2, if you lose weight, you'll get rid of PCOS. Again, this kind of goes back to, it's your fault because you're overweight. Now, while we do see higher rates of obesity in individuals with PCOS, it's not necessarily caused by the PCOS. It's caused by other conditions that go along with it, like insulin resistance, and losing weight may help to improve some of the symptoms of PCOS, but it's not guaranteed to eliminate your PCOS. And if 50% of women with PCOS are obese, that means 50% are not. So we do see this in women of all shapes and sizes. It is not your fault that you have PCOS, and although I encourage weight loss to be part of your healthy lifestyle if that is needed for you, it's not going to cure PCOS. Myth number 3 is that PCOS is a rare condition. We see PCOS probably in about 5 to 10% of women. However, only about half are diagnosed properly. That means up to 50% of those women don't know that they have PCOS, but they may be struggling with fertility because they're not ovulating correctly, and they may have other signs and symptoms of PCOS. So this is a common condition affecting around 5 million women in the United States. Myth number 4, you can't get pregnant if you have PCOS. Now, while it is true that women with PCOS have a more difficult time getting pregnant naturally, you may still ovulate occasionally, meaning you could get pregnant if you're not trying to prevent pregnancy and you're sexually active. Women with PCOS can still get pregnant through the help of fertility treatments if you're trying to get pregnant, so that can be in vitro fertilization or medications to help improve the rate of ovulation. But even without medical intervention, pregnancy is still possible. So if you don't want to get pregnant, you should be doing things to prevent that. Myth number 5 is that PCOS only affects overweight women. Now, while if you're overweight or obese, the symptoms of PCOS may be exacerbated, they may be worse. PCOS can affect women of all shapes and sizes. And so just because you're thin and you're having symptoms, you're having pain, you're having hirsutism, that excess hair growth, or you're having hormonal acne, just because you're thin doesn't mean you couldn't have PCOS. If you're trying to get pregnant and you're just not able to, it's possible that it could be PCOS. It's estimated that 70% of women who are struggling with fertility issues could have PCOS. So just because you're thin doesn't mean it's not affecting you, and it may be something you want to discuss with your doctor. It's important to understand fact versus fiction when it comes to PCOS so that you can properly treat, properly get diagnosed, and be able to live a more full and healthy life and avoid some of the comorbid conditions that may come along with PCOS. Let me know if you've heard any of these myths, and if you found this video helpful, be sure to share it with somebody who could also benefit. I'll see you back next time.